Hello, beautiful new mothers. It's your trusted guide, Hannah from LittleStarParenting. Have you ever wondered why some breastfeeding sessions are seamless while others are challenging and painful? Today, we're diving into the art of mastering breastfeeding through achieving the perfect latch. Ensuring your baby latches correctly is essential for a pain-free and fulfilling breastfeeding journey. Together, let's unlock the secrets to a successful latch. Before we get into the how-tos, let's explore the whys. A proper latch is the gateway to efficient milk transfer, ensuring your baby receives all the essential nutrients they need. Not only does it minimize nipple tenderness, but it's also the cornerstone of a deep and beautiful connection between you and your baby. Think of it as the first language between the two of you. So, how do you recognize a superstar latch? A good latch is when your baby's mouth is open wide, as if in mid-yawn, with both lips flanged out like a fish. More of the top part of the areola should be visible. Look for full, rounded cheeks and the gentle rhythm of their swallowing. These are telltale signs of a good latch. It's like watching a well-coordinated dance, harmonious and in sync. Remember, your comfort is paramount too. Finding that sweet spot in your breastfeeding position, whether it's cradle hold, football hold, or side lying, is crucial. Always remember your baby should come to you, not the other way around. This minimizes strain on you and encourages a better latch, setting the stage for a beautiful performance. Now follows a step-by-step guide to achieving the perfect latch. Initiate with skin-to-skin contact. Think of this as a gentle prelude to the main act. Skin-to-skin contact helps both you and your baby relax and prepare for feeding. Encourage a wide mouth. When your baby opens their mouth wide, gently guide them towards your breast, ensuring their chin makes contact first. Positioning. Aim for their nose to be opposite your nipple and their head slightly tilted back. Their chin should touch your breast, and their mouth should cover a good portion of the areola. Observe and adjust. Don't fret if the first try isn't perfect. Like any art form, practice and patience go hand in hand. Look for those full, rounded cheeks and the gentle rhythm of swallowing. The journey isn't always smooth sailing. Challenges like tongue ties or unique nipple shapes can be speed bumps on your breastfeeding path. But every challenge has its solutions. Lactation consultants can be like personal guides on this journey, illuminating the way. Their expertise can turn your challenges into triumphs. Listening to your body and your baby is crucial. Persistent pain, skin changes, or concerns about your baby's weight aren't mere roadblocks. They're signposts indicating you might need some guidance. Recognizing when you need support and seeking it out is a sign of strength and empowerment. Dear new mothers, embrace this journey with all its bumps and turns. The path of motherhood is filled with learning curves, but with the right tools and mindset, you'll navigate them like a pro. You're doing an awe-inspiring job. Mastering the art of breastfeeding is a journey that requires patience, practice, and support. By focusing on the perfect latch, you set the foundation for a successful breastfeeding experience. Remember, every step you take is a step towards a stronger bond with your baby and a more empowered you. Stay connected, stay informed, and above all, stay empowered. See you in our next video.